Hey guys, Dr. Chad. Today we're doing our first interesting case that I want to share with my viewers. Again, this is an actual patient that I'm treating. So why did I decide to do interesting case shared with everyone is, it's important the first doctor you see. I've said it many times in my advertising, social media, my commercials. The first doctor you see pretty much determines the path that you will go on for the rest of your medical life. And once you get surgery, as we will discuss in this situation, you can never go back. It is a one-way street. And once surgery is done, many of the less invasive options are off the table. As I said in my commercial a while back, minimally invasive surgery is still surgery. It is a one-way street. Good or bad, whatever the result is, you have to live with it. So the reason I'm sharing these stories is to give you a real life experience, a real life picture of what happens when surgery goes wrong or something happens and you're never the same. And I think it's important to share these stories because you do want to meet someone first that can present all the different options out there before you go down a road that you can't come back from. Today's case is a very unfortunate lady that injured her neck in the mid-early 1980s. Don't remember exactly what happened, but injured some bones, herniated a disc, and ended up getting some numbness weakness. Had some conservative care, physical therapy, tried some injections, and those things didn't work. And then unfortunately, she required surgery. And today we're going to review the surgery that was done to her and what went wrong in that surgery and why she still has the problems that she has today. Before we look at the imaging, let's just kind of focus on anatomy so we understand what we're looking at. We're going to be looking at a visual aid of the neck CAT scan. It's called a sagittal image, which is looking at patients from the side. This would be the back of the neck, the front of the neck. You can see there's the bone, there's the disc. So we're going to be looking at how that structure was corrected or tried to be corrected during this surgery. And you can see these yellow things coming out. These are the nerves that control different parts of your arm. So here is the image. So you can see this side by side. This is the side. So back, front, bone, disc. You can see on a CAT scan, things are very black and white. CAT scans are good at showing bone and metal, not so great at showing disc. The one thing, when you look at this neck, you can clearly see that she's had a very large fusion. This is C4 to C7. You can see how much the bone has changed from the fusion. You can see here the screw is actually in the disc and it's not in the bone, so the surgeon actually missed the target. The other thing, as you're looking at this image, you can see the fusion moves forward too much, and you can see because of that, this bone here, which is C3, is moving backwards and is making a big bone spur. You can see here at C7T1, because of this bone formation moving forward, that you're developing this huge, what we call osteophyte that's pushing backwards. This correlates clinically in this patient. When I saw her in clinic, she had numbness pretty much throughout her hands, C7 as well as C8 distribution, which would be the pinkies, and she had significant amount of weakness. The other thing, when I saw this patient, most patients, when they have a fusion, the incision is made on the crease of the neck, so it's not a very big scar. This lady's scar encompassed her entire neck. The surgeon damaged her thyroid, so she now has thyroid problems, and she also damaged her vocal cords, so she has a difficult time speaking. This is a very unfortunate situation, and obviously who you meet first is very important because this lady's neck is going to have to be fixed. How will it have to be fixed? She will have to see a neurosurgeon, possibly have this hardware removed and her neck actually broke. She'll have to have the fusion extended up to C3-4, and she'll have to have the fusion extended below to C7T1 to remove these levels. Unfortunately, she's going to have a lot of neck pain despite this surgery with very little mobility, but because of the severity of the pathologies as I've shown, if she doesn't get it fixed, she's risking paralysis. From a pain standpoint, this is not a patient I would put a stimulator in because of the anatomy being so poor. She would basically be left with medication management, medical marijuana, maybe an intrathecal pain pump, But the simple procedures such as rhizotomies, injections, acupuncture, those type of things are just not going to help an unfortunate patient with this type of pathology. So this is the case of the week. I hope this helps some of my viewers out there. Again, if you have any questions about what you see here or my comments, please post. I'll be happy to respond. Obviously, you have to respect HIPAA, and there's certain things I can answer and certain things that I cannot, but I'll do the best of my ability to interact with you guys. So thanks. Look forward to seeing you guys soon. Thank you.